Hey guys, welcome everyone to a Read Harrison series with Dr. Patil, and in this module we are going to take a very important topic, that is fever. Now fever is definitely an extremely important topic because like for internists, general practitioners, fever is a day-to-day phenomenon, right? Like every second or third patient who walks into a physician's OPD or a general practitioner's OPD is coming there because of fever. The underlying reason for fever may be myriad, right? It may be simple like a sore throat, or maybe as complex as certain cancer, but fever is a common complaint, right? So what we are going to do today is first we will understand the basics of how body regulates the temperature, why it is essential for the body to regulate the temperature in a specified range, and then we will understand why fever happens and how do we deal with it. Okay. So first point is, what is the normal body temperature? Now I will ask you a very basic question. Do you think our body temperature will be same on the periphery or on the skin as well as the core of the body, that is your internal organs? Obviously no, right? Now the body temperature inside, that is the core or internal organs, is definitely much higher than the surface temperature or the oral temperature. So that begs the basic question. Even I'm shocked by the NEET results and the controversies that are happening. Absolutely terrifying experience for the students who have given the NEET. Hopefully government takes a note of it and then comes out with resolutions or solutions for the problem. Okay, so now I will start with the Harrison itself, and when you look into Harrison, when you go to the chapter fever, the first thing he mentions is the body temperature is controlled by hypothalamus, right? And most important thing is we need to maintain a normal range of body temperature, and this is required mainly because we have to run the metabolism of the body, right? So all of the metabolic reactions that happens at the cell level or molecular level need certain pH range and certain temperature range. Beyond that, these metabolic processes fail, and that means that we are inching towards death, right? So it is very important for human body to regulate the pH and the temperature in a very specified range. And what is that normal range? Okay, so when we say body temperature, I am primarily referring to the core of the body. So the core body temperature, the normal range is 36.5 to 37.5 degrees Celsius. Now again, in India, we routinely practice the Fahrenheit as the unit of expression for temperature, and in US they follow this Celsius, and that creates a lot of confusion and headache, especially if you are giving exams for USMLE or UK exams like PLAB or MRCP. I have gone through that because I prepared for USMLE and also for the PLAB and MRCP. So in UK exams I had to follow the Fahrenheit, and in US exams I had to follow the Celsius. So it used to create a confusion, right? So can anybody convert this core body temperature of 36.5 to 37.5 degrees Celsius in Fahrenheit and tell me, or what is the formula for conversion of the temperature from Celsius to Fahrenheit? So the formula goes like this: the Fahrenheit is equal to 9 by 5 degrees Celsius plus 32 plus 32. So always remember this formula, this will come in handy. I do agree that in today's context we don't need to remember the formulae. Once you become a doctor and you start practicing, you always have the calculators or chat GPT, or even if you ask Google, it will give you the answer. But till you get the degree in your hand and become a practitioner, for your practical exams, please remember this formula. If you have to convert Celsius into Fahrenheit, you have to multiply the Celsius with 9 by 5 and then add 32 to it, and that will give you the Fahrenheit. So the normal core body temperature ranges from 97, if you apply this formula, 97.7 to 99.5 degree Fahrenheit. That is the core body temperature. Okay. But if you record the body temperature orally, that is the routine practice, right? When you record the temperature, you mostly record oral temperature, right? So what is the oral temperature? Will it be higher or will it be lower than the core body temperature? The oral temperature is it going to be higher than the core body temperature or lower? Normally we breathe through mouth, right? So because of that, there is heat dissipation from the oral cavity. So the oral temperature will be lower than core body temperature. How much lower? Generally around 0.4 degrees Celsius lower than the core body temperature. So the normal oral range is 35.5 to 37.3 degrees Celsius. Can anybody express that in the Fahrenheit for me? I have given you the formula, so express that in the Fahrenheit. And here we have to remember that in routine practice, obviously we are not going to do rectal temperatures, right? Ideal method of recording the body temperature is getting the core body temperature, and the best method to get to know the core body temperature is to do the rectal temperature, but it is very inconvenient, cumbersome. Most of the patients may not give the consent to you, so mostly we end up recording the oral temperature, right? So the mean oral temperature is around 36.6 degree Celsius. Clear? This is our normal body temperature, right? Ideally, when we refer to body temperature, we are referring to the core temperature. Whenever we record the oral temperature, it is going to be 0.4 degrees Celsius lower than the core of the body. Okay. Now I have already told you, for us to run the metabolic activities of the cell, we need to maintain the core body temperature in this range. How do we maintain that? Right? So we will first understand how do we maintain the body temperature, and then we will go to the fever. Okay. So imagine yourself stepping into your most advanced, fanciful Mercedes or BMW car, right? As soon as you get into your car, you have the AC, right? The moment you turn the car on, the AC also turns on, and in the AC you have this auto mode, right? So in the auto mode, all you have to do is set the auto mode and then set the temperature you want, right? Let me say I have set the temperature to 21 degree. Now the car's internal temperature may be more than 21 degree or lesser than 21 degree, right? If it is hot summer and the car is parked outside, as soon as I get in, the temperature may be 40 degree or 50 degree inside the car. I have set it to 21. So now what the AC will do? AC will start blowing out cold air to bring the ambient temperature inside the car to 21 degree, right? Okay. Similarly, let me say that, okay, I am in Himachal, it is cold, snowy winter, right? The car is parked outside. I get into the car. As usual, my temperature is set at 21 degree. Now, actual temperature inside the car, let me say, is 10 degree. Now what AC will start doing? It will start blowing out hot air to elevate the temperature from 10 degree to 21 degree, right? So what I have done, I have set a temperature of 21 degree in my car. So if the ambient temperature is higher, the AC will blow cold air. If the ambient temperature is lower, the AC will blow hot air to bring it to 21 degree. Body also works in the similar manner. So just like how I have set the temperature of 21 degree in the AC, body also has a set temperature. That is what we call as the thermostat. Thermostat. So our body temperature, core body temperature is set at the range of 36.5 to 37.5 degrees Celsius. So where is this thermostat present? The thermostat is present in hypothalamus. Hypothalamus. Right? So hypothalamus is acting as our thermostat. Okay. Now hypothalamus has set the body temperature to a particular range. This is what we call as the thermostat set point. Okay. Now depending on the fluctuations in the body temperature, hypothalamus will decide either to increase the body temperature to bring it to that set point or decrease the body temperature to bring it to that set point. So hypothalamus always tries to regulate the temperature around this set point. Now how can we regulate the body temperature? Right. How hypothalamus will get to know that the body temperature is increasing or the body temperature is decreasing? Well, in your skin and the periphery, we have the thermoreceptors, right? We have the warm and cold receptors from which the neuronal signal will reach the hypothalamus, telling you that, okay, your body temperature is rising or decreasing. Second, from our internal organs, right? If the internal organs or the core body temperature is high, the temperature in the circulating blood will also increase. This blood will definitely go to hypothalamus. So that will tell you the warmth or the temperature of the blood will tell the hypothalamus what is your core body temperature. And from periphery, we definitely have the receptors, right? So the hypothalamus is acting as the thermoregulatory thermostat and it has a set point. Okay, now if it gets to know that the body temperature is increasing, if the body temperature is increasing from the peripheries or the skin, it will reach the information will reach the thalamus through the receptors, and from the core of the body the information will reach through the blood. Okay, so once the hypothalamus recognizes that your body temperature is becoming higher than the thermostat set point, what it will do? How can we reduce the body temperature now? if it is increasing. How can we reduce the body temperature if the temperature is increasing? Hypothalamus has got to know, yes, your body temperature is higher than normal. So now we need to lose this heat, right? How can we lose the heat? How can we lose this heat? Yes. So one thing is we can lose the heat from the skin, right, to the environment. Whatever heat is there in the body, we can give it to environment through convection, right? Second thing we can do is we can sweat. We can sweat profusely and that will cool the body, right? That is one mechanism. Now think of the opposite. Let me say that my body temperature is dropping. My body temperature has dropped below the set point. I need to increase the body temperature. How can I increase this? How can I increase the body temperature? Yes, vasodilatation will bring the more blood from the core of the body to the periphery. That is what you see here. If you cause vasodilatation, more blood will come to the skin, so that temperature from the core of the body is taken to the skin and we will lose that temperature to the environment, right? So one mechanism by which I can increase the body temperature if it has dropped below the set point is shivering. This is what we call as shivering thermogenesis, right? How shivering increase the body temperature? Shivering basically means we contract the muscles. So when we contract the muscles, for the act of contraction, muscles are burning the calories and that is generating the heat. This is how we can increase the body temperature. Shivering is one. Second, there is also a non-shivering thermogenesis. Apart from shivering, there is a non-shivering thermogenesis where basically the sympathetic nervous system gets activated and your metabolic rate increases. So tissues start burning more calories and that will also increase the body temperature. So this is how we regulate the body temperature, right? By sweating and losing the heat to environment, we can reduce the body temperature, right? And if I have to conserve more body temperature or increase the body temperature, I can also shiver. And there are also non-shivering mechanisms like increasing the basal metabolic rate. And I forgot to mention one more important point. When we need to lose the temperature from the body, we cause vasodilatation, so that blood from the core of the body comes to the periphery and it brings the heat from the core of the body to the periphery and we will lose that heat to the environment. And opposite happens when I have to conserve the body temperature. For example, if body temperature is lower than the set point, then there will be peripheral vasoconstriction. And by vasoconstricting, more blood is deviated towards the internal organs and less blood is there in the periphery. So we will lose less heat from the skin, right? This is a mechanism for regulating the body temperature. 2-3 MCQs will be asked. First one is, where is the thermostat located in human body? The thermostat is located in the hypothalamus, right? What is the thermostat set point? The set point is close to this core body temperature range, that is 36.5 to 37.5 degrees Celsius. In physiology, they might ask you, how do you regulate the body temperature? Now, having understood this, let us come to the crux of the matter, that is fever, hyperpyrexia and hyperthermia. These are the three terms which we need to understand, because every time somebody's body temperature is elevated, need not always mean fever, right? So first point is fever. How do you define fever? I have already given you the normal temperature range. What is the normal temperature range? Core is 36.5 to 37.5, oral is 30.5 to 37.3. The mean oral temperature is 36.6 degrees Celsius. Increasing body temperature need not completely define fever, right? So first let us define fever. What is fever? Technically, fever is defined as body temperature greater than 37.7 degrees Celsius, which transpires to be around 99.9 degree Fahrenheit, plus along with that there is a reset thermostat set point. Then we will call it as fever. Now I will tell you what does it mean. Okay, so think of it. I go to trekking in the hot, humid climate, right? I want to climb a very steep, difficult mountain. As I go up, I get a lot of dehydration, hot sun, right, literally on my head, and my body temperature starts rising because I'm exposed to this hot sun. Can I call this condition as having fever? My body temperature now might become 41 degree, 42 degrees Celsius because I am out on the hot sun. Can I call this as fever? No, right? Okay. Now I got sore throat and my body temperature is high. Can I say this is fever? Yes. What is the difference between the two? In the first scenario, when I was out on the trekking and I was exposed to hot, humid climate, the body temperature increased because the external environment gave heat to me, right? It is not the hypothalamus's attempt to increase the body temperature. In fact, my hypothalamus may be trying to help me lose the heat. So when I'm climbing the mountain, I would be sweating profusely so that I would be cooling my body temperature. So hypothalamus is trying to bring my body temperature back to normalcy, but environment is so harsh that hypothalamus fails and my body temperature rises. That is exactly what we call as hyperthermia, where hypothalamus is failing to regulate the body temperature despite its attempt. But fever is condition where the set point itself is elevated. So I was giving you an example of me going to the car and turning on the AC, right? So next time I go to the car and I set the temperature 25 degrees Celsius. So now this time car will make every possible attempt to elevate the temperature to 25. So that's the difference. So in hyperthermia, the elevation in body temperature is despite your hypothalamus's attempt to control it back to normalcy. In fever, hypothalamus itself is the criminal. It has elevated its set point. The set point which was in the normal range is now elevated. Like for example, let me say it has been elevated to 39. So now your whole body is making an attempt to bring your temperature to 39. So this is a very, very important point. There is elevation in the thermostat set point, right? Let me take you through Harrison and let me tell you what he says about it. So Harrison also defines the fever as 37.7 degrees Celsius or higher, or 99.9 degree Fahrenheit or higher. Okay. 2 points I had already told you. The rectal temperatures are generally 0.4 degrees Celsius higher than the oral readings, because when we take oral readings, we are dissipating the heat through mouth breathing. Okay. Nowadays, during COVID, there was a trend towards using the tympanic membrane thermometers. They are not very reliable, right? And there are two modes of taking the reading. One is an adjusted mode and an unadjusted mode. Adjusted mode tries to account for the variables and give you the closest reading to your body temperature. But most of us are not used to it, so we are familiar with unadjusted mode. And when you look at the unadjusted mode, the tympanic membrane temperature is 0.8 degrees Celsius lower than the rectal temperatures. Okay, the axillary temperatures are not reliable and should not be practiced, because axilla is one place where the amount of sweating is generally more than the rest of the body part. So it can always be having a lower body temperature or higher body temperature depending on the level of sweating. So axillary body temperature is not reliable. Either take the oral temperature and add this correction formula of 0.4 degree to that will give you the core body temperature or the rectal temperature. Okay, so fever is an elevation in the body temperature that exceeds normal daily variation, and it occurs in conjunction with increase in hypothalamic set point. That's the key takeaway. He has given an example, right? Let me say the set point was at 37 degrees Celsius. Now because of whatever reason, the set point is elevated to 39. Now body is making all possible efforts to keep the temperature at 39. So body will send them signals down to shiver, right? It will increase the metabolic rate, and that is why the body temperature gets elevated to 39. Clear? Okay. Now the next term that we need to understand is hyperpyrexia. What is hyperpyrexia? Pyrexia means fever, right? Fever and pyrexia mean same. We can also call fever as pyrexia. Hyperpyrexia refers to more severe form of fever. More severe form of fever. So therefore I will address that point. More severe form of fever. So when do I call it as hyperpyrexia? It is called as hyperpyrexia when you have fever. I have already defined what is fever. Fever refers to increase in body temperature beyond 99.9 degree Fahrenheit with the reset thermostat set point. So when you have fever of more than 41.5 degrees Celsius, which roughly transforms to fever of 106.7 degree Fahrenheit, we call it as hyperpyrexia. Okay. Reset thermostat. See, that's what I was giving you an example, right? When you have a geyser at home, right? The geyser has a set temperature. So whenever you turn the geyser on, it will heat the water to that level, right? Similarly, your car AC, if it has an auto AC, So you have set a temperature. So the car's AC will try to regulate the temperature around that point. If it is more, it will cool it down. If it is less, it will heat it up. Same happens with respect to body. So hypothalamus is a main regulator of your body temperature, and it has a set point. Means it knows that okay, the body's temperature has to be regulated around 37 degrees Celsius. I'm giving you an example. So whenever body temperature increases more than 37 degrees Celsius, hypothalamus will send the signals to the body to cool the body. Means you sweat and you cool the body so that the temperature drops down to 37. If it has dropped down below 37 for some reason, like it is 36, now the hypothalamus will send the signals to the body to shiver and increase the metabolism and thus generate more heat and elevate this 36 to 37 back. So this point at which the hypothalamus tries to keep the body temperature is what we call as the set point. So in fever, what happens? The set point itself is elevated. Instead of 37, it has become 38. So now body is trying to regulate the body temperature at 38. That's fever, right? Hyperpyrexia is more severe form of fever when the temperature has exceeded 106.7 degree Fahrenheit. Okay. Then what is hyperthermia? Hyperthermia refers to core body temperature greater than 40.5 degrees Celsius, which transforms to temperature more than 104.9 Fahrenheit with normal thermostat set point. Thermostat set point means your hypothalamus knows I have to regulate the body temperature around 37 degrees Celsius, but it is not able to do that because the environmental factors or other factors are so challenging that it is failing. To give you an example, right? One example I've already given. People working in hot, humid conditions during summer, many of them develop hyperthermia because too much of heat is delivered to the body. Now the amount of sweating that hypothalamus can stimulate is not sufficient enough to bring the body temperature to the set point. The set point is fixed, but it is not able to bring the body temperature to that set point, so your body temperature is high. Another example you might have come across in pharmacology books called as malignant hyperthermia, right? So there are some drugs, when used, they stimulate extensive contraction of the muscles, and when muscles contract, they generate heat because they burn ATP, glucose and other calories to generate ATPs, and this process generates heat. So that heat starts increasing the body temperature. So if I am increasing the body temperature to a level where the cooling ability of the hypothalamus cannot bring it back to normalcy, then the temperature will definitely remain high. Here hypothalamus is making every possible attempt to bring the temperature back to normalcy, but it is failing, and that is why the body temperature is high. This is what we call as hyperthermia. In fever, hypothalamus is the criminal. It has elevated the set point, and that is why whole body is trying to increase the temperature. In hyperthermia, body is probably the criminal, like in malignant hyperthermia. Hypothalamus is innocent. It is trying to regulate the body temperature, but it is failing. Clear? Okay. In burning means when you, like when the patient gets burnt by the flames, right? You mean that, right, Nilanjana? Yeah, so that will be counted as hyperthermia. Hyperpyrexia is where the thermoregulatory set point is elevated. So when external heat is applied to body, as long as your hypothalamus is fine, there is no change in the set point. We may not be able to regulate the body temperature. That is the second story, right? Okay, now coming to the main point. So we have understood the terms. We have understood what is a normal body temperature. We have understood how the temperature is regulated by the hypothalamus with the help of sweating, vasodilatation, vasoconstriction and shivering. We have understood three terms: fever, hyperpyrexia and hyperthermia. Now we will understand the pathogenesis of fever, how fever happens. For that, let me take you to Harrison, and today we will learn two important points. First, whenever body is battling against infections or inflammation, right? When body is going through infections, exposure to toxins or inflammations or immune reactions, there will be increased activity of monocytes, macrophages or endothelial cells which produce certain chemicals. These chemicals is what we call as pyrogenic cytokines. They are called as pyrogenic because P-Y-R-E, pyre refers to fire, right? They are called as pyrogenic because they have the tendency to increase the body temperature. So we call them as pyrogenic cytokines. Most important ones are interleukin 1, interleukin 6 TNF, particularly TNF alpha and interferon 1. These are important pyrogenic cytokines. What do? From your monocytes, macrophages or endothelial cells, these substances are released. Through circulation, these substances will reach the hypothalamus. Once they reach the hypothalamus, they will stimulate the production of prostaglandin E2, right? And this prostaglandin E2, by increasing the activity of intracellular cyclic AMPs inside the hypothalamic cells, it increases the thermoregulatory set point. So before infection, let me say the set point was at 37 degrees Celsius. So body was trying to make an attempt to keep the body temperature around 37 degrees Celsius. Now once I got an infection, in the fight to infection, body produced interleukin 1, interleukin 6, TNF alpha, IFN1. These have reached the hypothalamus, stimulated prostaglandin E2 production, and because of that, this set point is now changed to, let me say, 39 degree Celsius. Now once the set point is changed, right, now hypothalamus will send the signals to the body to keep the body temperature around 39 degrees Celsius. And that is why there will be increased heat production through shivering, right, increased metabolic rate, and there will be heat conservation through vasoconstriction. Blood vessels will constrict so that the periphery is getting less blood, and I will be losing less heat from the body, right? Most of the core temperature is now conserved. There will be increased heat production by shivering and increased basal metabolic rate, and that is how the body temperature elevates and we develop the fever. So the main point here is that we are elevating the thermoregulatory set point. So it is simple like going to AC car and changing the set temperature from whatever previous reading to a new reading. Now the whole car AC will be making an attempt to elevate the temperature to that level. So same thing is happening in the body. The infection leading to inflammatory cytokines like IL-1, IL-6, TNF and interferon are elevating the thermoregulatory set point of the hypothalamus to a higher level. Now the whole body is making an attempt to keep the body temperature at that level. That's the point. Now the role of prostaglandin E2 is very, very important here, because when someone gets fever, what medications we give? We give NSAIDs, right? How are they helpful? Because they reduce the prostaglandin E2 synthesis. Or paracetamol, aspirin, they are effective antipyretics because they reduce the prostaglandin E2 synthesis, right? So if I block the prostaglandin E2 levels, the thermoregulatory set point that was elevated, it will come back to the normalcy, and the body will make attempts to keep the body temperature around the previous normal set point. Clear? Okay. So that is the pathogenesis of fever. Now before I talk a little bit about the management of fever, there's one common question that old time examiners ask during bedside discussion is the pattern of fever. Okay, and there's one point to note here. These patterns of fever in today's clinical practice are absolutely irrelevant. So if I am your examiner, I will never ask you anything related to patterns of fever, but you will still get examiners who ask about it, so we should know. Why I don't ask about the patterns of fever? Because in the today's context where paracetamol, aspirin are readily available as over-the-counter drugs, you just go to the pharmacy and say I have got fever. The first thing he will give you is paracetamol. If you say I have already taken paracetamol and it is not coming down, he might give you aspirin or ibuprofen. So in such cases, this whole pattern collapses, right? The second thing is go to the pharmacist and say I got sore throat. The first thing he will give you apart from paracetamol is an azithromycin. So the use of antipyretics and antibiotics has collapsed all these patterns, and we don't see these patterns anymore in today's practice. But nonetheless, at least for writing in your exams and answering your old examiners, we need to know, right? So there are different patterns of fever. The first pattern is called as continuous, and the second one you can see on the screen is called as remittent. Okay. Now, for me to make it easier for you to understand these graphs, let me tell you, this green line that you see here, take it as the baseline or the normal body temperature, right? Let us count it as normal body temperature. Okay, that is the baseline body temperature. So when it is more than that, that is where the body temperature is elevated, right? When it is more than 99.9 degree Fahrenheit, that is 100 or plus, is fever. Okay, and also let me tell you, between these two lines that you see, this roughly represents 1 degree Fahrenheit. Okay. Now, can anybody look at these two graphs and tell me what is the difference? In both of them, the temperature is not on the baseline. It is elevated, right? It is higher. In both of them, it is higher. So that means there is fever. The temperature is elevated, right? And there is variations in the temperature. What is the difference between the first graph, that is continuous fever, and the second graph, that is the remittent fever? So when you look at the first graph, first thing you notice is that in a 24-hour period, right, temperature has always remained above the baseline. It has never come down to the baseline. It is persistently elevated. Second point, yes, there are fluctuations, but the fluctuations are not more than 1 degree Fahrenheit. Fluctuations are lesser than 1 degree Fahrenheit. Just to give you an example, right, let me say a patient's temperature is always 38.5, right? It is 38 plus, more than the required temperature to call it as fever. It is 38.5. It goes to 39, comes down to 38.2, goes to 38.8, but it has not seen the fluctuation greater than 1 degree Fahrenheit. Then I will call it as continuous fever. So continuous fever refers to, right, fever, right, or the body temperature above the baseline, temperature greater than normal for more than 24 hours. Fluctuations are present, but whenever fluctuation happens, it is less than 1 degree Fahrenheit. In the second graph that you see, it's called as remittent. So here also the same thing. The temperature has never touched the baseline. It is always above the normal value. In the 24-hour period, it has never come to baseline. But the fluctuations here are, you can see here, from here to here, it is definitely more than 1 degree Fahrenheit. Then we call it as remittent. So in remittent fever, temperature is always more than normal for more than 24 hours. Fluctuations present, and these fluctuations are greater than 1 degree Fahrenheit. Greater than 1 degree Fahrenheit. So the fluctuations in continuous fever are very minimal, less than 1 degree Fahrenheit, right? Even if it rises, it will elevate by less than 1 degree Fahrenheit. When it drops, it will drop by less than 1 degree Fahrenheit. So there is no more than 1 degree Fahrenheit variation, and always above the normal value. In remittent, temperature is always above the normal value, but there is a great fluctuation greater than 1 degree Fahrenheit. In what conditions I get this continuous fever? I get this continuous fever particularly in viral fevers. That's why when we had COVID, dengue, or any other viral fevers, right, fever is continuously high. And this is like these patients' attenders, right? If you are a practicing physician, they will always be irritating you, saying that, sir, 2 days since admission, fever has not come down, because it is always going to be high. Okay. The remittent fever, the classical example I can give you is infectious endocarditis. Infectious endocarditis is a classical example. Okay. Then we have a fever called as intermittent fever. Now when you look at this intermittent fever, within a 24-hour period itself, you can notice that the temperature reaches the baseline. Temperature reaches the baseline. Variations are there, but it is touching the baseline. In continuous and remittent, in a 24-hour time period, it has never reached the baseline. It was always above, right? It was always elevated. But in intermittent, temperature goes up, comes down to baseline. In real practice today, this is a pattern we see, because patients will take paracetamol. When they take paracetamol, temperature will touch the baseline. After that, once the paracetamol effect is over, temperature will elevate again. They take another paracetamol, it will touch the baseline. So this is the kind of graph that when you go to wards, your sisters will show you. That's the routine now. Rarely we would be seeing these graphs because we have antipyretics today. A classical example for this intermittent pattern of fever is bacteremia. Now what do I mean by bacteremia? So when you have a bacterial infection, let me say you have a staphylococcal abscess somewhere. From the abscess, intermittently the staphylococcal organisms will reach the blood and start circulating in the blood. So whenever they reach the blood, body will produce interleukin 1, interleukin 6, TNF, and the set point will be elevated, the temperature will get elevated. Once the immune system reduces the circulating bacterial load, the temperature will come down. Again, some load of bacteria will come into the blood, again the temperature will increase. But in between two bouts of bacteria coming into blood, the temperature will reach the baseline. So intermittent is where within a 24-hour period, right, temperature touches baseline intermittently. then we will call it as intermittent fever. Okay. Now there is one more pattern of fever which is called as relapsing fever. Relapsing fever. Now what does that refer to? So in the first three graphs I have shown continuous, remittent and intermittent. I have shown you a graph of only 24 hours because in that 24-hour period in continuous, fever never came back to baseline. In remittent it never came back to baseline. In intermittent, within just one day fever had touched baseline multiple times, right? Here it had touched the baseline. But then you have some fevers where fever runs for days, then the temperature reach the baseline for few days, and then again the fever will run for few days. This is what we call as relapsing fever. So relapsing fever is where fever runs for few days. Okay. Then for few days there is no fever. Then again fever comes. This is what we call as relapsing fever. So like, okay, today, tomorrow, day after tomorrow I have fever. Next few days I don't have fever. Then again 3-4 days I have fever. Then next few days I don't have fever. Then again 3-4 days I have fever. This is what we call as relapsing fever. Three examples I want you to remember for relapsing fever. The first one is malaria, the second one is typhoid, and third one is Hodgkin's. Okay. And depending on at what frequency the fever appears, we have some names, right? So the names like tertian, quartan and Pell-Epstein. All of them are subtypes of the relapsing fever. Okay. So what is this tertian fever? Where fever occurs at a periodicity of 48 hours, cycles of 48 hours. Quartan refers to fever occurring at cycles of 72 hours. And Pell-Epstein is a peculiar type of relapsing fever where the fever follows this pattern of 3 to 10 days. Means 3 to 10 days there is fever, 3 to 10 days, and then next 3 to 10 days there is no fever. Then again next 3 to 10 days there is fever. So a cycle of 3 to 10 days fever, 3 to 10 days no fever, 3 to 10 days fever, 3 to 10 days no fever. This goes on. This is what we call as Pell-Epstein type of fever, which is typically seen in Hodgkin's disease. This is frequently asked as an MCQ. Where do you get this Pell-Epstein type of fever? But the fact of the matter is this is all for your exams. In reality, you are rarely going to recognize any of these patterns because we interfere with the nature of the fever by giving antipyretics and empirical antibiotics. Okay, so now we have understood about some important patterns of fever. Okay, so now before I take you to a quick look at the management of fever, we will get back to Harrison and understand few more points. So let me summarize what we have learned so far. We have understood that hypothalamus is the regulator. Set point is there in the hypothalamus. The normal core body temperature ranges from 36.5 to 37.5 degrees Celsius, which amounts to 97.7 to 99.5 degree Fahrenheit. We call it as fever when the temperature increases more than 99.9 degree Fahrenheit, right? And when we are recording the temperature, the ideal site of recording the body temperature is the rectal temperature, which is the closest we can get to the core body temperature. But rectal body temperature is generally 0.4 degrees Celsius or 0.7 degree Fahrenheit higher than the oral temperature. That is why whenever you record oral temperature, you have to add 0.4 degree Celsius or 0.7 degree Fahrenheit to it to get to the core body temperature, right? If you are using the tympanic membrane thermometers, please remember that the values are going to be 0.8 degrees Celsius lower than the rectal temperature. So you have to add 0.8 if you are using the tympanic membrane thermometers. Okay. Then we have understood what is fever. Fever is a condition where body temperature is more than 99.9 degree Fahrenheit with the reset thermostat. Hyperthermia refers to body temperature more than 40.5 degrees Celsius with the normal thermostat. Reset has not happened. Hyperpyrexia is just a severe form of fever where the body temperature is more than 106.7 degree Fahrenheit. In terms of mechanism, the main reason for resetting of the thermostat is the production of inflammatory cytokines like IL-1, IL-6, TNF and IFN, and the mechanism that they follow to reset the thermostat is production of prostaglandin E2, and that is why blocking the prostaglandin E2 production is one way of treating the fever. Okay. Now I want to ask you a question. Can we get conditions where body temperature may be elevated because increased production of these without infections? Without infection, elevation in interleukin 1, interleukin 6, can that happen? See, in the recent times COVID, we saw a lot of patients having fever, and we used to test interleukin 6 levels in COVID patients, right, because it is elevated. Yes, on exposure to allergens, right, all your autoimmune disorders. For example, you go back to your rheumatoid arthritis in the pathology books, and you will notice that there is increased production of TNF. That is why when you treat rheumatoid arthritis, you give anti-TNF alpha drugs. You go to SLE and look at the pathogenesis of SLE, you will get to know that interferon 1 levels are elevated. That is why when we treat SLE, we have a drug called as anifrolumab, which inhibits interferon 1. So apart from infections, autoimmune disorders can also cause fever, right? So in such cases, we generally don't need to treat fever per se, treat the underlying cause and the fever would come down. But how many of you know this term called as auto-inflammatory syndromes? Autoimmune disorders are different, auto-inflammatory syndromes are different. Can you give me an example for an auto-inflammatory syndrome? Auto-inflammatory syndrome. We can get the intermittent fever in various conditions, mainly the bacteremia. Auto-inflammatory syndrome. Okay, psoriasis can be counted as an autoimmune disorder itself. And auto-inflammatory, a classical example, many of you are familiar, it is called as familial Mediterranean fever. Familial Mediterranean fever. Okay, so that is a condition where patients have recurrent episodes of fever and joint inflammation, not because of production of antibodies or the cell-mediated injury. See, when you say rheumatoid arthritis, you know that you have this rheumatoid factor, anti-CCP antibody. When you say SLE, you have ANA, anti-dsDNA, anti-Smith, anti-histone, and a long list of antibodies, right? So in autoimmune disorders, either the cells or antibodies are causing the injury to the tissues. Autoinflammatory conditions are where the cells are not causing direct injury to the tissues and there is no production of antibodies. Only the inflammatory cytokines are elevated in levels. So this familial Mediterranean fever is a condition where because of mutations, their body produces increased levels of interleukin 1. And because of this increased levels of interleukin 1, whole of this pathogenesis will be triggered and patients will have episodes of fever. You investigate left to right and you find nothing because there is no infection, there is no autoimmune disorders. Only when you take the history that the patient comes from the Mediterranean belt, right, countries around this Mediterranean Sea, and then he also tells you that he has a family history, that is where you start suspecting that patient may be having familial Mediterranean fever. So that is an example for what we call as auto-inflammatory syndrome. No cell-mediated immunity, no antibody-mediated injury. It is merely because of the mutations in genes involved in production of interleukin 1. Okay. So now coming to the management of fever. How would I manage the fever? Simple. Two things are there. If it is simple fever, generally management focuses on antipyretics, right? Antipyretics, and the classical examples are NSAIDs. Most commonly used one, as we know, is going to be paracetamol, or the second most commonly used one is going to be aspirin. Okay. Then when we have hyperpyrexia, means when the body temperature is more than 106 degree, 106.7 degree Celsius, Fahrenheit, right? Hyperpyrexia. In such cases, merely using NSAIDs is not enough, right? I have to involve more actively in cooling the body temperature. How can I do that? So in such cases, we have to give them antipyretics plus, right, cooling blankets. In India, in our hospitals, cooling blankets are not readily available. So what do we do, right? जो पानी में डुबो के पट्टा रखते हैं सिर पे या छाती पे, those are all the practices which can bring down the body temperature. So one hand we will try to reset the thermostat back to normalcy, but we will actively assist in cooling the body temperature, either the cold sponging, wet sponging, or cold cloth on the forehead, on the chest, or ideally speaking the cooling blankets which we can set the temperature and regulate it. That is how we manage hyperpyrexia. Okay, if I have hyperthermia, how do we treat hyperthermia? Can I give antipyretics in hyperthermia? See, cooling blankets are just like, in your cars you get these seats which can be heated or cooled. Seats itself can be heated or cooled. Similarly, there are blankets which can be heated or cooled. So we make the patient wear the blanket which we can externally cool with the device, so that we will be able to absorb the heat from the body through those cooling blankets. Okay, will there be any role of NSAIDs or the antipyretics in the treatment of hyperthermia? Remember, I have already told you what is hyperthermia. In hyperthermia, there is no resetting of the thermostat, right? There is no resetting of the thermostats. So that means there is no role of antipyretics. So in such cases, what should we do? We have to only do what is called as active cooling, right? When you say active cooling, you can do cooling blankets, right? Or you can also do rectal cold saline wash or infusion. So in these patients, when they are going through hyperthermia, we can infuse cold saline into their rectum, or we can give the cold saline wash to the rectum, or we can give cold saline fluids to cool down the body temperature. So we need to do some active cooling. We cannot play with antipyretics when we have hyperthermia. So hyperthermia is totally a different entity. Okay, so let us get back to Harrison and see what he talks further about it. So he has already discussed about the pathogenesis of the fever, and then he mentions what all conditions can lead to fever. And the most common condition that can lead to fever is infections, right? The second thing I told you, autoimmune disorders where these pyrogenic cytokines can be elevated, that is another condition. Cancer is a third condition. Then we know that medications, vaccines, drugs can also cause fever, right? Certain endocrine disorders like hyperthyroidism can increase the body temperature, and dysfunction of the hypothalamus, right? Okay. Now, few points to learn here. If you have a patient with fever, does it make sense to check the cytokine levels? The answer is no, right? Have you seen anybody checking interleukin 1 levels in a patient with fever? No, right? So there is no role of checking the interleukin 1 levels. Okay. Now he also mentions a small section where he discusses about the patients who are receiving anti-cytokine therapy. Like if you have rheumatoid arthritis, you will be giving anti-TNF alpha medications. If you have SLE, you will be giving the anti-IFN1 treatment. So in such cases, those drugs can blunt the effect of fever. So even when they have infection, a patient with rheumatoid arthritis, if he has an infection, he may not develop fever because you have blocked the TNF. If you have a patient with SLE and he is on treatment, he may not develop fever because we have blocked the interferon 1. So we should always keep that in mind. So if patients who are receiving anti-cytokine therapy, they may not manifest with fever when they have infection, and for a doctor he should have a high index of suspicion, and only suspicion may lead to diagnosis, and if you rely on the temperature you may be misled. And then he mentions a little point about anti-cytokine therapy, means using this interleukin 1 or TNF alpha blocker drugs for treatment of fever. And as I have already told you, he focuses on the autoinflammatory disorders like the familial Mediterranean fever. Then there is one more condition called as adult onset and juvenile onset Still's disease and hyper IgD syndrome. So these are all autoinflammatory syndromes where directly blocking the inflammatory cytokines makes sense, and there is no role of antipyretics there because primarily the set point is elevated because of elevated interleukin 1 or TNF alpha. So we directly block them. Can anybody give me an example for a drug that blocks the interleukin 1? Because the drug of choice for familial Mediterranean fever is blocking this interleukin 1. Okay, yes, we have an anti-inflammatory drug called as colchicine, which is the first line management when it comes to familial Mediterranean fever. We use this drug called as colchicine, but when colchicine fails, we use anti-interleukin 1 drugs. Example is anakinra. Still's disease is again another autoinflammatory disorder where patients develop the arthritis and episodes of fever. This kind of resembles rheumatoid arthritis, but there is no autoimmunity involved here. In rheumatoid arthritis, you clearly have the antibodies. You have anti-CCP antibodies, rheumatoid factor. So in this condition, it is not having antibodies. That's why it is counted as an autoinflammatory disorder. So we can use drugs like anakinra and canakinumab. Anakinra and canakinumab. So these are like monoclonal antibodies which can block the interleukin 1. Okay. So Harrison also talks about the mechanism of antipyretic agents, which I don't need to really elaborate. We all know the mechanism of action of NSAIDs by blocking the PGE2 production. But one point he specifically mentions, which is very important, like if I have, let me say, some joint pain, and if I take paracetamol or aspirin, will my body temperature drop? No, right? Because the prostaglandin A2 has no role in regulating the set point of the thermostat in normal conditions. PGE2 will get elevated only when these inflammatory cytokines are elevated. Normal conditions, thalamus will do its job without the role of PGE2. So if I take NSAIDs, right, it will not reduce the core body temperature. Only when I have fever, it will reduce the body temperature. Without fever, NSAIDs have nothing to do with the body temperature. Okay. So that's it about the fever today. This is just the beginning. There are few more topics on fever which I will add whenever I get the time. Okay. So there is one more topic that is fever with rash. And then most importantly, which is a final prof 10 marks, 20 marks question, which is pyrexia of unknown origin or fever of unknown origin. Because many a times, despite aggressive investigation and attempt to find out what is the reason for fever, we don't find it. Such cases is what we call as pyrexia of unknown origin or fever of unknown origin. And that is like, we say that is a real challenge, right? As a physician, how skilled and how knowledgeable you are is tested when you face the first patient with fever of unknown origin, right? Many times I get calls from my colleagues, juniors and seniors saying that I have a fever patient. I've been investigating from last couple of days, 3 days, 1 week, 10 days, and I've not found the cause. That is what we call as fever of unknown origin, that we will discuss in the subsequent video modules. Yes, there are plenty of iatrogenic causes for fever, Nilanjana. For example, many drugs, right? Just to give you an example, fluoroquinolones like your ciprofloxacin, right, or ofloxacin, they themselves can cause fever. Right? Drugs can cause, vaccines, when we take vaccine, obviously yes, vaccine is nothing but a subtle infection that we're inducing to stimulate the immune system. So when there is infection, we will get fever. Most of the vaccines, especially kids, after vaccination, next 2 to 3 days, they will be running with fever. So there are plenty of iatrogenic causes for fever. Okay. Anakinra is, yes, it is anti-interleukin 1 monoclonal antibody. That's the first monoclonal antibody that came out against IL-1. Now we have more effective monoclonal antibody against IL-1, that is canakinumab. Okay. I have no idea about what is the next topic. I will share the list soon, but I am trying to include the fever with rash as well as the pyrexia of unknown origin within this month itself, so that by the end of this month, the more common cardinal manifestations are covered as most of you had requested. I'll be leaving few MCQs for you to solve based on the physiology as well as whatever we have discussed about fever today. See you day after tomorrow, guys. Till then, have a good time. Bye-bye.